So I'm going to take you through an example of a GP working in a multidisciplinary primary care clinic. And the reason we chose this particular case study is it's really relevant to any practitioner or clinician working in a private practice setting or other clinical service. Because the standards and actions will be fairly similar and relatable. So for a GP, they have a role across multiple components of the step system of care. So GPs absolutely have a role in prevention, so that's bolstering protective factors and preventing harm. They have a role in identifying warning signs and symptoms. They have an absolutely crucial role in that initial response and also in ongoing medical monitoring. And some GPs might also be providing the primary mental health treatment as well, depending on their experience and training. Today, I'm going to really focus in on the initial response, as I think it's as a role, it's something that a lot of us could understand and relate to. So under initial response, there are 5 specific standards. So relevant to a GP, we have standard 2 and we have standard 5. So standard 2 relates to conducting that initial response. So that's screening, assessment, preliminary diagnosis, providing psychoeducation and making an appropriate referral. And standard 5 relates to having information to assist with referrals during that initial response stage. So we've identified the standards specific to the GP role. So then let's go to that next level, which are the actions that sit under those standards. So under standard 2, there are 2 primary actions. Firstly, that GPs can access training so that they are knowledgeable and skilled to provide that initial response. And the second one is for a GP to be able to actually fulfill that initial response in an ongoing way. So really we want GPs to be trained to do this work, and we want them to do that initial response role or fulfill that role. Under standard 5, again, there are 2 actions. The first one relates to primary health networks, having comprehensive health pathways accessible. So a GP might have a role in developing those health pathways or advocating for to their local PHN to enhance their eating disorder content. And the second one is promoting credentialed clinicians. So in the role of a GP in making those appropriate referrals, they would be using the Connect ED website so that they can identify a mental health professional and dietitian that is trained in eating disorders. So from that, we've got 4 specific actions that a GP would be mapping out a plan for. And when I'm talking about the GP role, we can also be thinking about practice managers, practice nurses. So, you might have a leadership role within a GP practice that similarly could identify these roles and actions. So related to those 4 actions, some of the resources that a GP might use or need are the training so that they can fulfill that initial response. They would need to have clinical tools, so having a screening tool and assessment, particularly the EDEQ if they're using the eating disorder treatment plans. They would need to be familiar with professional guidelines on the medical management of eating disorders so that they can provide that ongoing role. They have psychoeducation resources in their little toolbox so that when they're working with their patient, they can provide really clear information. And of course, using those available service databases to make appropriate referrals. Importantly, also understanding eating disorder organisations and services. So for example, supporting a family or carer to engage with Eating Disorders Families Australia to access that extra support. And in terms of the paperwork side of things, having referral templates which outline, some of the assessments that have been done, and connecting with those referral pathways is a really helpful step as well. In terms of connections or partners that a GP might need to support the actions, is that do it together. So if you're working in a practice, connect with those other clinicians. If you've created that toolbox, share it with your colleagues so that not everyone is starting from scratch. You'd be finding a training provider to access the GP training, which is available freely online. Connecting with those organisations and services in your local context so that you know who you can refer to. Connecting with eating disorder coordinators if they do exist in the local area. and really connecting with that local PHN, and so understanding, again, that local context. So that's an example from a GP. And so hopefully you're all really keen and you thought, I can follow those 5 steps. So it's not too complicated, and are really just gets a clear sequence of how you might be able to take next steps. So as I mentioned before, that we've actually developed those 5 steps into a resource for you. And so I will be putting a QR code up so that you can access that via our website. So what that does is takes you through each of those 5 steps, and it's got the fillable drop-down section. So that will bring up all of the standards and all of the actions for you so that you don't have to go through the full national strategy document if you don't want to. So please, if you need this in a different format or have any feedback, please provide that to us after the forum.